This is Indian Country Today.
Esquili, yes, thank you for joining us. I'm Patty Tholhungba. Here are the headlines for Thursday, July 2nd, 2020. Hollywood is coming to a pueblo in New Mexico. A former casino is being turned into Camel Rock Studios in hopes of attracting big productions. It's owned by the Pueblo of Tesuque and is located north of Santa Fe. The studio has more than 25,000 square feet of shooting space. The tribe decided to open the studio after scenes from the movie News of the World, starring Tom Hanks, were filmed there last year.
But the unique thing about this, because it was a converted casino, is that we have standing sets here. You can see that there's something that looks like a hotel lobby check-in. There are restaurants, there are bars, there's a stage for performance, there's a small area that could be a cafe.
The tribe also set aside more than 17,000 acres on the Pueblo for additional filming space. Due to the pandemic, there are no productions in place now, yet the tribe says several companies have called to schedule time in the future. And 3 Native Americans are now members of the Directors Branch of the Academy of Motion Pictures Arts and Science. The Academy announced this week that El Maya Tailfeathers, Sidney Freeland, and Sterling Harjo have been inducted into the Directors Branch of the Academy. They join a class of 819 new inductees. Calls for removing the sculptures carved into Mount Rushmore are mounting by tribal leaders in South Dakota. Oglala Sioux President Julian Bear Runner calls it, quote, a great sign of disrespect. Now Cheyenne River Sioux Tribal Chairman Harold Frazier is releasing a statement that reads in part, nothing stands as a greater reminder to the great Sioux Nation of a country that cannot keep a promise or treaty than the faces carved into our sacred land on what the United States calls Mount Rushmore. This brand on our flesh needs to be removed, and I am willing to do it free of charge. The U.S. recognized the Black Hills belonged to the Sioux in an 1868 treaty, but less than 10 years later broke that treaty once settlers discovered gold in the hills. Mount Rushmore was carved out by a known Ku Klux Klan member into the Black Hills. This weekend, President Trump and South Dakota Governor Kristi Noem plan on renewing the Mount Rushmore fireworks display on July 3rd. One fire expert called it an ill-advised activity due to the dry conditions. Alaska Tribal Health Organizations and the City of Anchorage are getting a donation of medical supplies. The donations are coming from the Taiwanese government and a Buddhist foundation. Personal protective equipment will be distributed throughout the state through the Alaska Native Health Consortium. This is the second donation from the two groups. The donations include surgical masks and face masks. And now for an update on COVID-19 cases in Indian Country, let's go to our Washington editor, Jordan Bennett-Begay. Jordan?
Patty. So we go into a long weekend ahead with COVID-19 updates of 7 tribes in Indian Country. And here's a look at the numbers from our database. There are 12,034 positive cases and 494 deaths in the Indian health system. Again, that is a total of 12,034 positive cases and 494 deaths as of July 2nd. 2 tribes in Nebraska reported more cases. The Winnebago tribe has 6 new cases on its reservation, bringing the total to 72 cases and 3 deaths. And next door to the Winnebago is the Omaha tribe, and they have 8 more cases, giving them a total of 74 cases and 2 deaths. In Nevada, the Pyramid Lake Paiute tribe reported 3 new cases, giving the tribe a total of 33 cases and 1 death. And in Arizona, where there's a surge of cases right now in the country, the White Mountain Apache tribe saw an increase of 42 cases and 2 more deaths. This gives the tribe a total of 1,783 cases and 24 deaths. And for the Navajo Nation that spans across parts of Arizona, New Mexico, and Utah, they reported 64 new cases and 5 additional deaths. And the tribe is going to lockdown its weekend, the first of the 3 lockdowns that was announced by the Navajo Nation President, Jonathan Nez. And again, portraits from the pandemic is an important part of the story, Patty. One of those stories was Joseph Allen Sky Sr. of the Cheyenne River Sioux tribe, and he was a father of 8 who died from COVID-19. And his family says that he was a gifted cook and a jack of all trades.
Thank you, Jordan.
Yeah, Patty.
And we'll be right back.
This is Indian Country Today.
Welcome back. When it comes to the health of men, where do our Native men stand? Men are known to be reluctant in getting their yearly checkups and general overall preventive health care. We also know the bleak health statistics when it comes to Indian health. So how can you make sure the men in your family are taking care of themselves? Joining us to answer those questions is Dr. Dawn Warren. Dr. Warren is the Associate Dean of Diversity, Equity, and Inclusion, as well as the Director of Indians into Medicine at the University of North Dakota. Welcome, Dr. Warren.
Thanks for having me. Very glad to be here.
Well, let's start with the health, the mental health of men in this pandemic. What are you seeing among Indian men and how they're dealing with this pandemic?
Well, one of our big challenges is that the baseline level of health was already poor for American Indians generally speaking, but in particularly for American Indian men. So when you have a baseline low level of health, adding something like a pandemic can make things much worse. So when we think about some of the health issues that we face, you had mentioned mental health. For American Indians, as we know, unfortunately, we have higher rates of things like depression, addiction, and suicide. And for men, the suicide rates are even higher than for women. So we already have a terrible disparity with mental health for American Indians, but American Indian men, even worse, unfortunately. So when you have something like a pandemic where we are calling for things like social isolation or social distancing, that's actually not good for mental health. So I really prefer the term physical distancing rather than social distancing, because we actually need to have social connectedness in order to maintain health. And in addition to that, if we're feeling socially isolated, it could make people who are already feeling depression or suffering from addiction, it can make those problems even worse. So we're seeing in the field anecdotal reports that things are worsening on those fronts. Of course, once we have more time to collect data, I think we're going to see a spike in some of the mental health concerns, not just the physical health related to the pandemic.
So even changing that word of social distancing into physical distancing can help alleviate some of the stress?
Well, it's more than changing the words, but I think really the approach is that we might have to stay 6 feet apart physically, but we really need to stay connected as much as we can socially. And having social connectedness is an important part of overall health. And even from a traditional perspective, we understand these things, that we have a more holistic view of health in terms of not just physical health, but mental health, emotional health, and spiritual health. And social connectedness is an important part of holistic health, but unfortunately not something that we focus on very well in modern medicine.
And that's a really important part of the discussion, is looking at how to bring in traditional ways of healing. So let's say, everything is quote unquote normal. Even in normal times, we, as you mentioned, know that the state of health in Indian country is not the greatest. So in these days, how are Native men, what has been the trend for Native men to get their checkups, to look at making sure that they're taking a proactive stance on taking care of their health?
Well, unfortunately, we have terrible disparities. And when we look across Indian country, we see disparities, but even within Indian country, some areas of IHS and parts of Indian country are worse than others. So for example, here in the Northern Plains, if we look at the Dakotas, for men, we have higher rates of death due to unintentional injury, but also due to intentional injury. So higher rates of death due to suicide and homicide, as well as the unintentional injuries and accidents. In addition to that, we have higher rates of death due to diabetes. So one of the challenges there is that quite often, if we're not getting preventive care, not screening for things like diabetes, quite often we're diagnosing the disease relatively late into the process, and there could be complications from the disease even before we get a formal diagnosis. And historically, not just for American Indians, but all men seem to have lower participation in preventive care and going to the doctor. But it's even more pronounced for American Indians. And the challenge right now, we have this terrible combination of high rates of diabetes, and within diabetes, we can have high rates of depression. And people self-medicate their depression, whether it's alcohol or other types of substances. And then you throw on top of that a pandemic where people with diabetes are at higher risk for death and hospitalization. And then people with diabetes are also at greater risk for depression and going through the social distancing. We just have this terrible storm of external factors that are making the baseline poor health even worse during the pandemic.
So when we're talking about the state of Native health, for men, what are some of the things they can do, even in this pandemic, to take care of their health?
Well, ideally, we'd be addressing these things long before there was a pandemic. And of course, we're not in an ideal setting. And I've heard a lot of people saying, when are we going to get back to normal? And in truth, I hope we don't get back to normal. Normal is not good enough for us. We need to get back to better. And maybe the pandemic can shine a bright light on some of the challenges that we are facing. And perhaps we can recognize that we need better baseline level of health so we can absorb these types of challenges. We need to promote more health resilience among our people. But when we're facing high levels of poverty, other social determinants of health, a lot of unresolved trauma, and other factors that lead to poor mental health and poor physical health, the pandemic is really a difficult time to try to fix those things because we're facing other challenges. So what I'm hoping to see during the pandemic is that we at least have a greater understanding of these challenges, and let's develop strategies to overcome them now. One thing that seems to be encouraging is that if we have the right elected officials in this next election, some of them are recognizing that this is an issue and want to invest resources in improving Indian health. So we have to have better baseline levels of health, better systems and infrastructure to address public health. But that requires investment. And that's where I think the silver lining of the pandemic might be that we're shining a light on the issues, but the challenge is we're not going to fix them during a pandemic.
And we're hearing a lot of that, that this pandemic is really shining that light on issues in Indian country, and health being just one of them. But what can we do? What can, your mothers and sisters and wives do to encourage the Native men to get an appointment or checkup or something? Because a lot of times, things fester, as you talked about diagnosis. They're diagnosed later, too far down the road in some cases to have any good outcome. So what can family do to encourage Native men to go get checkups or to go check out something that's hurting, but they don't want to admit that it's hurting?
Well, one of the strengths of our traditional approaches for many tribes is that we did have a much more inclusive concept of what is family. And I know just in my own background that what I was taught is that traditionally we didn't have the idea of a nuclear family. It's an interesting term, is a nuclear family, where we just have a mom and dad and children. Actually, in the old way, it was the responsibility of one generation to raise the next generation. So I have just as much responsibility for my nephew as I do for my son. And a lot of our tribal cultures had very similar perspectives of that inclusive, wider ranging perspective of family. So I wish we could go back to that in many ways. I think it's a healthier approach. And within that, we need to be supportive of each other. And for a lot of our cultures, men's roles were being protectors. But in truth, a lot of our men are vulnerable, are at risk right now because of poor health status. So we need to be strong for each other and recognize that it's not just about the nuclear family. We need to look at our communities as our families and be supportive of each other as much as we can. Again, when we're immersed in social challenges and addiction and poverty and all the things that we're dealing with, it's hard to operate at that higher level of social functioning and supporting each other, but that's the direction we need to go. So again, it's going to be difficult to do that during a pandemic. We're trying to limit outpatient visits, outpatient surgery, for general health during the pandemic, so to try to limit the spread. So in this time frame, it's really a difficult time to try to fix those things. So again, we need to be cognizant that these are significant issues and we need to invest the resources to fix them. And hopefully we'll get through the pandemic in relatively good shape so we can now fix our public health infrastructure, but also strengthen our communities and help support those social determinants of health in a positive way.
I want to go back to the whole idea of physical distancing and the CDC guidelines of wearing a face covering. And there's been a lot of debate back and forth about what does that do. And then we look at photos of people, family gatherings, they're posted on social media, and the families are together, but they're not wearing any kind of face covering, and they're not, physically distancing. What would you recommend to these family members, especially as we're coming into a holiday weekend? Quite possibly people want to get together. What kind of message do you want to send to them in this pandemic and their personal safety?
Well, within your own household, obviously that's going to be much more difficult to have physical distancing. So I think among household members, you just have to have the understanding that if one person gets sick, the entire household is at risk. And again, thinking of social determinants of health, as we know, many of our reservation housing is inadequate, or we might have several generations living in one dwelling. So in responding to a pandemic, how do we quarantine people who've been exposed? How do we isolate people who are diagnosed as positive? It's almost impossible with our housing circumstances. So as people come together, if there are people that are not within your household, you need to maintain that 6 feet of physical distancing. And the mask isn't necessarily to protect yourself from getting COVID. It's that if you might have it, you're protecting others. So in truth, it's a way to show support for our community members and our family members by wearing a mask, some sort of good facial covering. So if you happen to be coughing or sneezing, you're not going to spread the virus. That's one way that's very easily spread. So we have to look at this not just in terms of our own self, but for our community members and family members and loved ones, people that we should be caring about. So wearing a mask really is a sign of respect for other people, that you're not going to be spreading it to them. And again, if you're coming into contact with people outside your household, it's very important to maintain that physical distancing. And we've even seen our traditional healers take dramatic steps. We've had ceremonies like Sundance canceled this year because they recognize that many people who come to these ceremonies are coming there for healing, and they might already be at physical risk anyway. We have a lot of people going through recovery that attend Sundance to support and to have prayers. Or we have people who might have diabetes or at very high risk for bad outcomes. So we've taken tremendous steps as traditional leaders in many of our tribes to postpone or cancel very meaningful ceremonies. Even as we know, powwows are canceled. So let's not waste that effort by having our families and groups come together in big groups and spread it anyway, because even our traditional healers are well aware of the science behind this, and we need to be respectful of that and not spread the disease to other people. Our communities are very vulnerable right now.
I think that's a really good way to put that, showing that sign of respect, and looking at so many of our traditional ceremonies that have been put on hold during this pandemic, and that's a case across Indian country. We're not coming together for a number of ceremonies. So, and that's good leadership, from the traditional people, and that kind of ties back into the work that you've done for the last 20 plus years, and being at the forefront of incorporating the medicine wheel into your medicine and into your teachings to this next generation. Because before, Western medicine never really considered mind, body, and spirit, but that's at the core of the medicine wheel. Talk a little bit more about that.
So in my own experience, I was very fortunate to grow up in a family with a lot of medicine men and traditional healers. And growing up, that was just our way of life, our way of being. So it never seemed out of the ordinary to me. It was just the way that we grew up in our family. And I was just very fortunate to have exposure to the beauty of our cultures and our traditions and our ceremonies, and that way of life is so meaningful to me. So that was incorporated into my own medical training. So when I think about the traditional perspective of health, we have to look at things not just in the physical arena, but also spiritual health, mental health, emotional health. And it's really fascinating. Another word for a modern doctor is physician, right? So we're saying right up front, as physicians in modern medicine, we deal in the physical arena. Physician and physical have the same Latin root, physic, which means the natural sciences. So in modern medicine, we're very good at the science of medicine, but not very good at the holism of medicine that we have in our traditional ways. So in my own experience, what's been very effective is to blend traditional medicine and modern science, and they can be brought together. Ironically, the traditional ways are much bigger. They transcend just physical medicine. So historically, I've been asked many times, how do you incorporate traditional medicine into your modern practice? And I say, I don't. I incorporate modern medicine into my traditional practice because the traditional practice is much bigger. Physical healing is important in traditional medicine as well, but we don't just take it apart from spiritual health, mental health, and emotional health.
Interesting. So you are also a senior advisor to the Great Plains Tribal Chairman's Health Board. Do these discussions come up there as well? And those leaders of those tribes, are they putting into practice what you've been talking about?
Yeah, so in that role, it's really focused on the policy arena. And within health policy, we have so many challenges. One of them, of course, is whether or not our health system embraces culturally appropriate healthcare. That is a big policy issue. And that is something that many of the tribes are starting to do because they can take over the management of their own health systems through Public Law 93-638, so self-determination in healthcare. Unfortunately, in the Great Plains area, we've been much slower to pursue self-governance and self-determination in health relative to other areas. For example, 100% of the facilities in Alaska, 100% of the facilities in California are managed by the tribes. And in Alaska, they actually have, right next to the primary care clinic, they have the traditional medicine clinic because they have tribal control. And from my perspective, I think we have enough empirical evidence that expecting the federal government to solve our health problems is not going to work. We need to manage that. We need to control that. And as Indigenous peoples, we've had self-governance for millennia. And to expect a federal agency to fix our health challenges is just not going to be effective. So in terms of the policy work, much of it's related to doing self-determination feasibility studies and also working with the tribes to promote awareness and opportunities within self-determination and self-governance in health. But a big part of that is the ability to incorporate our own ways of medicine into the system. It's much easier to do that under tribal management than it is under federal management.
All right. And so for you personally, how do you stay healthy and on an everyday basis, but now even more so in this pandemic? What are you doing for your mental health and for your physical health?
Well, what I was taught is that we need to be grateful and have prayer every day. And that's just incorporated into my usual routine, my family's routine. I'm very blessed to have a wonderful wife and children who are growing up really well connected to our traditions and our beliefs, and not just from a belief system, but actually a practice and the way that we live. So I've just been very fortunate to have support within the family. What's fascinating is that now in modern medical science, we're starting to realize that you can actually improve health by focusing on gratitude. There's actually very good research that shows what we are conscious of, what we really think about, has an impact on our physiology. And we kind of know this. If we get angry, we can feel our heart racing, our blood pressure go up. When we feel gratitude, we can have this sense of calm and wellness. It can have an impact on blood pressure and blood sugar. So science is finally catching up to what our indigenous healers have always known. And when I see terminology in the medical science saying we should have, every day we should be conscious of what we're grateful for. Well, to me, that sounds like morning prayer. You know what I mean? This is what we've been practicing for 1,000 years. And now modern medical science is finally catching up to that knowledge. And it's so effective that, if it was in the form of a pill, it would be standard medical practice. But because it's in the form of gratitude, acknowledgement, and prayer, it's alternative medicine, right? But it's just as effective. And these are things that I know from a cultural perspective, but it's also things that I know from a scientific perspective. And that's what we need to build out.
That's really great. I'm Hopi, and our belief is you wake up in the morning and you run and you say your prayers as you greet the sun. And so it is, that traditional indigenous knowledge and that take on medicine. And gratitude is a really good way to express that. So I really want to thank you for joining us today and talking about men's health. And it starts with that gratitude that you mentioned.
No, I was just going to say at University of North Dakota, we have, of course, our Indians into Medicine program, but also public health programs focusing on indigenous health. And I'm hoping to see more universities do that and embrace indigenous knowledge and modern science and bring those things together.
Very good. Well, Dr. Don Warren, thank you so much for joining us. And thank you for watching this edition of Indian Country Today. Take care of yourselves. Your life is precious. I'm Patty Thalahungba. Join us again tomorrow.
This is Indian Country Today.